If your knee twinges when you twist, squat, or get up from a chair, and you sometimes feel a click, catch, or a sense that it might give way, you could have a meniscus tear. The meniscus is the rubbery cushion inside your knee, and it is one of the most common structures to be injured, whether from a sports twist in younger people or from simple wear and tear as we get older. The word tear sounds scary, but many meniscus problems settle down with the right care, and surgery is not always needed. In this video I will explain what the meniscus does, why it tears. Inside each knee there are two C-shaped pieces of tough cartilage called menisci, one on the inner side and one on the outer side. They sit between your thigh bone and your shin bone and act like shock absorbers and stabilizers, spreading load across the joint and helping it glide smoothly. There are two main ways they tear. In younger, active people it is usually a sudden twist or pivot with the foot planted, often during sports, which can tear a healthy meniscus. In people over about 40, the cartilage gradually weakens with age, so a so-called degenerative tear can happen with something as ordinary as squatting or twisting. Common symptoms include pain along the joint line, swelling that often builds over a day or so, and a clicking, catching, or locking sensation when you bend or twist the knee. Some people feel the knee giving way, and deep squatting or twisting tends to make things worse. With a degenerative tear the onset can be gradual rather than tied to one injury. In the clinic a clinician examines how your knee moves, checks for tenderness along the joint line, and may perform specific twisting tests that gently stress the meniscus. An MRI can confirm a tear and show its pattern. But here is an important point. Meniscus changes are common. Here's the reassuring part. Many meniscus tears, especially the degenerative kind, improve without surgery. Early on, a sensible approach is to calm the knee down, reduce the activities that aggravate it, and let the swelling settle, while still keeping the knee gently moving rather than completely immobile. Ice, elevation, and short-term over-the-counter pain relievers can help with flare-ups, though it is wise to check with a pharmacist or doctor about what suits you. For many degenerative tears, a structured course of physical therapy works as well as surgery for relieving symptoms, which often surprises people. Surgery tends to be reserved for specific situations, such as a knee that truly locks and cannot fully straighten, or rebuilding strength around the knee is often the key to lasting improvement, because strong muscles share the load and protect the joint. Once the sharp pain settles, gentle range of motion work helps restore smooth movement. From there, strengthening the quadriceps on the front of the thigh, the hamstrings at the back, and the hip and glute muscles improves stability and takes stress off the meniscus. Low-impact options like stationary cycling, swimming, or controlled bodyweight exercises let you build strength without pounding the joint. A good rule of thumb is that mild discomfort during exercise is acceptable, but sharp pain, new swelling, or locking means ease back, because progressing too fast can stir things up. So when should you get evaluated rather than waiting it out? See a clinician promptly if your knee locks and you cannot fully straighten it, if it gives way repeatedly, or if there is severe pain or rapid, large swelling after an injury. Also seek care if the knee looks red, hot, and swollen with fever, which could suggest infection, or if you cannot bear weight on it, and if sensible self-care and time have not helped after several weeks, it is reasonable to get it checked. These signs may point to a tear or other injury that needs closer attention. To recap, the meniscus is your knee's shock-absorbing cushion. Tears can come from a twist or from gradual wear, and many cases, particularly degenerative ones, improve with rest, rehab, and strengthening rather than